See here. This is our external oblique muscle. It is our internal oblique muscle. This is our transverse abdominis muscle. This is our fascia transversalis. Okay, these four layers. This is the most outer layer. Okay, I didn't draw here scarpa, fascia, skin, other fascias. Okay, so now what you must have to remember in external oblique muscle, you have a defect present. This defect is known as superficial inguinal ring. Okay, then you have a defect present in the fascia transversalis. This is known as deep inguinal ring. Okay, which ring? Deep inguinal ring. Now, one more point which I explain you here, that these fibers are also joining together like this, and now they are forming here one tendon known as conjoint tendon. Okay, so you have to remember these points. Deep inguinal ring, defect in fascia transversalis. Superficial inguinal ring, triangular defect in the aponeurosis of external oblique muscle. And internal oblique muscle along with transverse abdominis muscle, they are joining together forming a tendon known as conjoint tendon. Which tendon?
Conjoint
Conjoint
tendon.
conjoint tendon. Okay, and now here this pathway is forming. See, this oblique passage or pathway, this oblique passage, it is known as inguinal canal. It is known as which canal?
Inguinal canal.
Inguinal canal. And through this inguinal canal, see here, through this inguinal canal, for example, this is the spermatic cord. It is passing through deep inguinal ring, passing through inguinal canal. Now it is passing through superficial inguinal ring, and now it is going here, giving or nutrition to your testes. Okay, but along with here inguinal, with the spermatic cords, for example, this is our which cord? Spermatic cord. Okay, so along here with spermatic cord here, a nerve is also entering here. This nerve is your which nerve? Ilioinguinal
Ilioinguinal nerve.
nerve. Okay, so all these are your MCQs. So they can ask you what is conjoint tendon. You can say that conjoint tendons, fibers of transverse abdominis and internal oblique muscles are joining here, forming this conjoint tendon. Okay, what is deep inguinal ring? Defect in fascia transversalis. What is superficial inguinal ring? Defect in external oblique aponeurosis. And this oblique passage or pathway which is forming here, this is known as your inguinal canal. And through this inguinal canal, which is your oblique passage or pathway, it is approximately, you can say, 4 centimeter long. कुछ बुक्स में 3.75 सेंटीमीटर भी लिखा हुआ है. So it is approximately about 4 centimeter long. So it is passing the spermatic cord in the males, ilioinguinal nerve, and in the females it is the round ligament of uterus. Round ligament of uterus, again the ilioinguinal nerve. Okay, but iliohypogastric nerve, please remember, iliohypogastric nerve, this iliohypogastric nerve, it is not entering into your inguinal canal. Okay, yes, it is piercing here, the external oblique muscle aponeurosis, but it is not entering in your inguinal canal. Okay, so this is a very important point which you must have to remember. Okay, it is clear to everyone.